Doctors at Cincinnati Children's Hospital are on the lookout for that inflammatory syndrome that appears to put some children at risk following an infection of COVID-19. But as medical reporter Liz Bonus shares, they have also been reassuring people with a message for parents.
For weeks now, doctors have been tracking symptoms of rashes, fever, and severe swelling in children following what appears to be an infection of COVID-19. The CDC calls this pediatric multisystem inflammatory syndrome.
And I think what the name is trying to convey is that it can affect basically any part of the body.
Pediatric critical care specialist Dr. Hector Wong says the main concern?
And a lot of it is manifested as a inflammation of blood vessels, which people call vasculitis. And as you can imagine, you have blood vessels all over your body, so that's why you can see multiple different organs being affected. It resembles something called Kawasaki syndrome, which we know is a systemic vasculitis, and sometimes the most affected organ can be the heart, including the coronary arteries that feed the heart.
And while it's often referred to as a mysterious illness, he says there is something right now he wants parents to know.
In my opinion, I think that this is not very mysterious.
For decades, he says, he's seen children with a similar syndrome after a viral illness.
The difference now is that there are so many kids who are infected with COVID. The burden is so great that you start to see some of these outliers become more prevalent.
The syndrome is highly treatable.
I don't recall the exact numbers, but untreated Kawasaki's, I believe about 20% of the kids will have serious heart complications. With treatment, that number gets reduced to about 5%.
And since early identification is key, if you have concerns, call your pediatrician. I'm medical reporter Liz Bonus reporting.
The team at Children's Hospital says it's researching a possible similar syndrome from several weeks ago, but still are not reporting any confirmed local cases.